See you again, Dr.
Good to see you too, Eric.
Now, could you please describe your profession for me?
Yeah, I'm a neurologist in private practice in Sarasota, Florida, and part of my work entails outpatient clinical practice as well as research in terms of drug delivery of neurological medications.
Okay. What problems do you face in your business?
Yeah, that's a tough question because there are a lot of issues in medical practice, not only in terms of insurance and patient reimbursement, but one that's most specific to me is that, I don't know if you know this, but I developed a drug delivery system that is a topical delivery. In other words, drugs do not enter the bloodstream but are rubbed in as a cream in the back of the neck, and they, through the free nerve endings in the back of the neck, they affect nerve function that eventually affect the brain and therefore reduce neurological symptoms. And I guess one of the problems I face is getting the word out in terms of this delivery because it is unconventional. It's what they call disruptive technology because the way we take medicines now is by mouth or by injection and it goes in the bloodstream. This bypasses that. So there are drug companies who don't want me to be successful, and there's skepticism also by the scientific community as well as patients because they don't understand how it works. And so that's one of the things I'm facing.
What ideas do you have for getting it out to the public? I heard you say something about that. Getting the word out?
There are two ways of getting the word out. Number one, you have to be careful when you're a physician dealing with drugs and, quote, getting the word out there. You don't want the word out there in the wrong hands, and you don't want it to be misadvertised, over-promising its effects and so forth. So, that being said, the FDA does require certain clinical trials to be done to show safety and efficacy of the drug, so that needs to be done from this point of view over here. And then there needs to be education, on the other hand, of the public. Presently, I'm able to use a drug as a compounded drug through a pharmacist individually for patients, but I can't manufacture it. So by word of mouth, it's getting out there. In fact, I just had a patient, young girl from Atlanta, had a patient from New York City come some time ago, one from California. So word is getting out, but it's haphazard, it's word of mouth. So I envision maybe a website type of thing. That would be kind of low-key, but just giving general information for people who are looking for this sort of mechanism of delivery that would be beneficial to them. And the key kind of people would be those that are on numerous medications who are having side effects, who don't want side effects for certain diseases like Parkinson's disease or ADD and so forth. Young kids with ADD can have sleep disturbance and appetite problems because of the systemic drugs. In this way, they're not having those things.
Now, could this help get the word out to people that are potential investors?
Sure, because, any kind of website attracts people from various angles, not only people with health problems who are looking for a cure, but, investors and drug companies are looking at other means of, enhancing their businesses. So, certainly.
Okay. And what would you really be looking for in the website? Or, let's say, to not narrow it too specifically, a brochure or something of that nature that we could get the word out there with? What would you be looking for with that?
I'd be looking for a description of the delivery and why it's different from what is currently offered. And what are the advantages of it? Less side effects. The drugs I use are generic drugs which are now cheaply obtained and can be repackaged in a novel fashion such that they can have a new patent life and be manufactured, therefore, because you don't have to do the extensive studies and extensive drug development much more cheaply. Currently, when you get a new drug that you try to find for a certain disease state, it's millions to billions of dollars to develop it and then eventually take it to market. I'm using drugs that are already developed, have a proven track record and safety record, but delivering it in a different way. Not systemically, but through topical delivery.
Okay, that's very interesting. Okay, thank you.
Thank you.
That should conclude the interview.
Thank you for having me.
Thank you.